I'm blushing over here and I am flattered to be back. Excited to be back with you all. So to get started, I'll introduce myself. My name is Olivia. I've been with Eisenhower for about a year, and I actually work in cardiac rehab. And my role there, I'll share my screen first just to get a little bit more of a visual going. Okay. And so hopefully now you should be able to see a PowerPoint and then also me in the corner of your screen. But my role at Eisenhower is I am the Intensive Cardiac Rehabilitation Program Coordinator. So over there, I do workshops that deal with healthy mindset, but also education involving physical activity, education involving nutrition. So looking at wellness in general. And I'm really excited to be talking about osteoporosis, exercise for strong bones, with you all today, because I feel it's an important conversation, and I'm excited to get to know you all a little bit better, engage in this conversation, and at the end, if you do have any questions, hopefully tackling as many of those questions as possible. That being said, although I am here with a PowerPoint, I want this to be a very interactive hour. So please feel free to have fun, write in the chat, comment in the chat, write jokes in the chat, whatever you would like, because although we are not physically in the same room, we're all together in this presentation, the Zoom room together. So I really hope it can be an interactive presentation. So with that being said, feel free to just write in the chat what you hope to learn from this presentation. And then hopefully by the end, we will have covered all of those topics. So if you feel inclined to, you can just kind of write in the chat what you hope to learn. So again, a little bit more about my background. That is my role at Eisenhower. I have a master's in exercise science, and then I also have a master's in positive developmental psychology, and am a PhD student as well. Also experienced as a personal trainer in the fitness industry too. So with that being said, we will go ahead and dive into this presentation. We may be familiar with osteoporosis, but in order to understand what forms of physical activity will be helpful for preventing osteoporosis, and if we've been and if we have osteoporosis, it's important to kind of take a step back and talk about the what behind osteoporosis. So it really occurs over time when the breakdown of bone happens more than our ability to actually build bone. So in osteoporosis, bone mineral density and bone mass decreases, and the quality and structure of our bones can change. So over time, if you were to look at this picture on the screen here, to the left of the screen is what would be considered a healthier looking bone. This in between has been described as what looks like honeycomb. And over time, if the breakdown of bone is more than our ability to build bone back, our bones can start to look more like the visuals that are on the right, where you see more of the spaces between larger honeycomb, and intuitively you might start to see, because there's more space there, our bones tend to become lighter, a little bit more frail. And this is important because if they're more frail, as is the case with osteoporosis, what can happen over time is it can lead to an increased incidence in fractures, broken bones, decreased bone strength overall. So this is definitely something that we want to be mindful of as we continue to age, and really at any point throughout a lifespan. So we might have, again, depending on our background, I love some of these questions already coming in. Can your bone recover from loss? Hoping to get off osteoporosis drugs. Really, really, really exciting conversations there. So what we're when you're looking at osteoporosis, it's considered a silent disease. And it's silent because oftentimes we don't necessarily know. We might not know that our bone loss is exceeding our ability to grow bone back or build bone back until it's too late. And by too late, I mean, we might have some sort of broken bone or a vertebral fracture. And symptoms of these could be, for example, a vertebral fracture, a fracture in our back, in our spine, could be back pain. It could be visually a loss of height, changes in posture. Typically, it might be a little bit more of a slumped forward. Keep in mind that what I'm talking about, the changes in posture, could also be related to other things as well. So not just because of osteoporosis or bone loss. So keep that in mind as well. And then everyday broken bones as a result of our bones becoming less strong. Our bones could fracture because of everyday activities if they are more frail. So examples here would be simply picking up a box, bending down, even coughing, depending on how frail our bones are. So in general, we want to be preventative if we can. And if we've already had something like this happen before, we do still have things that we can do to keep our bones strong from decreasing that bone mineral density over time. So risk factors for osteoporosis, sadly, it is more prevalent in women. So when you're thinking about bones, more frail bones, such as what someone with a slimmer build or women in general might have, you might intuitively understand a little bit more if the bone is a little bit more slender, how these fractures might happen more over time. As we age, our bone loss occurs faster and new bone growth starts to diminish over time. So although it's something that we want to be mindful of at any age, it kind of increases with importance as we continue to age. And then if parents have a history of hip fractures or osteoporosis, this is something that we need to be more cognizant of. And then if our diet is low in calcium and vitamin D helps our body to absorb calcium better. This is a risk factor as well. So diet is pretty important. And we're considering our intake of calcium and vitamin D throughout a lifespan as well. Some medications can be a risk factor for osteoporosis, and then our lifestyle can be very important. So genetic factors can influence are a risk factor. And then also talking about lifestyle factors, things that are more so in our control, such as our nutrition, what we're eating, our smoking habits, if we're chronically heavy drinkers, inactivity are all risk factors for osteoporosis. This list is not an exhaustive list of all the risk factors for osteoporosis, but are ones that we might want to consider. It's also important to consider prevention. So if we understand what some of the risk factors are, especially lifestyle, these are things that we might be able to be a little bit more proactive about moving forward. So for example, eating foods that are rich in calcium, such as low-fat dairy products, sardines, salmon, green leafy vegetables, and calcium-fortified foods and beverages can be really great to be proactive there. Getting more vitamin D from the sun or from a supplement, and then always consulting with a physician if you are going to be taking any new supplements. And then also doing weight-bearing exercise like brisk walking every day, which we will be talking about later because that is the focus of today's presentation. not smoking and not drinking too much from alcohol are all activities that we can do to help prevent osteoporosis or prevent our bone loss from getting worse. So the question then is, if we don't already know, how do you know if you have osteoporosis? And the number one piece of advice is to check in with your physician. And it could be diagnosed in a physical exam. So some of the symptoms that we talked about for osteoporosis might come up in the conversation, such as if there is a loss in height because of a fracture in the vertebrae, this might be something that might prompt more questions. If posture changes, again, maybe because of fracture in a vertebrae, this might engage in more conversation around the topic. And then there's ways that you can actually measure your bone mineral density. And an example here is the dual energy X-ray absorptiometry, or DEXA, would be one way to actually measure it. But it all starts with having that conversation with the physician. If you're noticing that you're experiencing those symptoms, definitely bringing it up with your physician when you meet with them next. Because at the end of the day, our goal here is to slow or stop bone loss and prevent fractures. And we can do that in a number of ways. We talked about nutrition. So diet high in calcium and vitamin D in particular, medication in particular situations. And I appreciate that being brought up in the chat as well. Fall prevention, which we'll talk about in relation to physical activity, and then exercise. So the big question is, why would exercise be important when it comes to bone loss and preventing bone loss? Because the research tells us that over time, when we regularly engage in physical activity, and the key word is regularly engage and over time, our bones become stronger. And exercise can help us with, if our goal is keeping the bones strong, preventing fractures, it's important to also have a conversation about fall prevention, because exercise can also help us to strengthen muscles, enhance our coordination, maintain balance if we strengthen those muscles that help us stay strong and help us stay balanced. And so by engaging in physical activity, and we'll talk about two types in particular, we can help to keep our bones strong, and then it can also help us to keep our muscles strong that can help us for fall prevention. And the two types of physical activity that we are going to talk about here is weight-bearing exercise and muscle strengthening exercise. Weight-bearing exercise, I want you all to think about physical activity that's against gravity. So interesting fact here would be that astronauts have to engage in a certain type of physical activity when they're in outer space, because their bone mineral density decreases about 1 to 2% every month, because they don't have the effect of gravity. So you're thinking really anything that's working against gravity here. So working your body against gravity. Hiking is a great example. Climbing stairs is a great example. Moving the body against gravity. Dancing, so any dancers out there, and playing tennis. And these weight-bearing physical activity, forms of physical activity can help to reduce bone loss and increase bone formation. Now, our ability to do this is stronger in our youth. However, we do have some ability to prevent further loss as we age if we're continuing to engage in these forms of physical activity. Something we need to be mindful of as well is, if I have never played tennis in my life, which I am not a strong tennis player, I'm not a strong pickleball player. Any pickleball or tennis lovers out there, I appreciate you. I have all the respect in the world for you because I'm working on my coordination. If you have someone like myself who might not be as experienced, and I'm making and I'm pivoting quickly on the court, something that we need to be mindful of there is, again, our goal is to prevent bone fractures. So if we are pivoting on the court quickly, needing to move really quickly, we just want to make sure that we have prepared our body to be able to do that sort of movement. So if we haven't done anything like that in a while, and we're considering taking up an activity like that, it would be good to maybe focus on building our muscles that help to protect our joints, or our muscles that help us for stabilizing before we start to engage in activity that we could be at risk for falling and fracturing or breaking a bone. So just something to be mindful of. So the take home point here is these movements where we work against gravity are great. Hiking, climbing stairs, dancing, playing tennis, but we need to be mindful of to what extent do we need additional a support example here would be for hiking. Do we need hiking poles to stay balanced? Because if a con such as falling outweighs the pro, then we really need to be setting ourselves up for success on that. And I'm super curious from forms of physical activity. I'd love to hear in the chat just forms of physical activity that you all enjoy doing, whether it be hiking. I love that. So all of the questions that are in the chat, I might be able to answer some during this time. If not, hopefully at the question and answer. So I'm seeing sea otter, Cindy, I love that, the sea otter. Swimming is a favorite. Denise is talking about Tai Chi and yoga. Could those be forms of physical activity that are more so weight bearing? Some forms of yoga and Tai Chi, you could definitely argue that they are weight bearing exercises. You want to make sure that in these forms of physical activity, you also have one foot on the ground. And we'll talk about this a little bit more later, but we aren't talking about jumping upstairs. We aren't talking about sprinting here or running in general, things where 2 feet might be off the ground at once. We're talking more about the lower impact forms of physical activity that can help us progressively to strengthen. So you could argue some forms of Tai Chi and yoga would be a form of weight bearing. And I love the question here, what about folks that can't play anything or walk without a walker? And I think that really speaks to meeting us where we're at. My example here of hiking, there might be some people in this Zoom where we aren't necessarily concerned about the risk of falling. So some people might be able to hike without poles. Some people might prefer to hike with poles. For some people, hiking would not be an appropriate form of physical activity. So even an example such as walking with a walker, you're still working against gravity. So it's still a great weight-bearing form of physical activity. Walking on an even paved surface compared to a gravel or rocky surface that might be a little bit more that might have more obstacles in the way for walking would be another recommendation there. So it's definitely finding the activities that meet the person where they're at. You do not need to hike up the tallest mountain in order to get the benefits of strengthening bones. We can be walking down to get our newspaper in the morning or get the mail from the mailbox, walking around the house any of those forms of physical activity, that weight-bearing physical activity would be good examples. Okay, and some of these I'm gonna return to a little bit later. But yes, Pilates, I would also compare to yoga and Tai Chi, where you could definitely argue that some forms of Pilates could be weight bearing, where you're working the body against gravity. What about doing squats using a walker? Robin, I love that. And it's like you're helping me transition to my next slide. So I appreciate that. So we talked about weight bearing. So any sort of movement, working your body against gravity, where you'll have one foot on the ground. And then, which helps to keep our bones strong. And then we also want to talk about muscle strengthening. And although we wouldn't necessarily think if we're targeting the muscles, the interesting part, although we are focused on strengthening muscles with weight training, with muscle strengthening, the research tells us that lifting weights also helps us keep our bones strong and healthy. And benefits here are that we are targeting muscles that really can help us to prevent from falling. So this is where an activity such as Pilates would be really helpful, because you are strengthening the muscles of the core that can help us to stay upright and balanced, developing muscles that help to support balance. So you're talking about not only the core, but also the lower body, the glutes, the muscles that help to support the hips. And these sorts of exercises, again, although we are building up the muscles that help to prevent us from falling, the research does tell us that lifting weights or strength training can help to keep our bones strong as well. And I love these questions here, one being about stationary bikes. Stationary bike is a great form of cardiovascular activity. It's very heart healthy. It is great for keeping in terms of our body weight in management, if that's a goal. It's a great form of physical activity. Something that we want to keep in mind of is when we are riding a stationary bike, we are creating the level of resistance for ourselves. We are strengthening muscles of the lower body, especially for focused on adding more resistance, but still keeping our pace relatively consistent and comfortable. So we are strengthening the muscles of the lower body. A difference here would be when I am stepping, say 1 foot at a time, and I'm working my muscles against gravity, that's where I'm getting more of the benefits from the weight-bearing form of physical activity. It's more of a low impact form of physical activity compared to the non-impact forms of physical activity, where you're not necessarily lifting your foot fully off of a surface and putting it back down, compared to so non-weight-bearing forms of physical activity, the no impact forms of physical activity where you're not necessarily hitting a surface with your foot would be an example, such as swimming, such as riding on a stationary bike. Low impact forms of physical activity would be examples such as walking. It could be walking with a walker. It's a great example. Could be hiking, climbing stairs, dancing, playing tennis here. And then the high impact forms of physical activity, such as running, would be another example of a weight-bearing form of physical activity. If someone hasn't built up their bone strength over time, we just want to make sure that we're progressing them properly. So I'm going to return back to the high impact forms of physical activity and how that impacts our bodies in a bit. So we've talked about weight-bearing forms of physical activity. These are important. Muscle strengthening forms of physical activity. These are also important to help prevent the body from a fall. In terms of weight-bearing forms of physical activity, the recommendation there, I'm really going to recommend progressively challenging the body. So especially during COVID, what I have heard a lot of people have experienced is decreased levels of physical activity in general because we have been in quarantine because of no fault of our own. So our habits might have changed. We might not be moving as much. So it wouldn't necessarily be healthy for me if I have been sedentary for all of quarantine for then me to go and try to run a marathon, right? That's not setting me up for success. So instead, the goal here is maybe this week, this week, I'm going to slowly build up my form of physical activity, how often I'm doing weight-bearing forms of physical activity. Maybe it's going to be a little bit every day. Maybe it's going to be 5 minutes every day, maybe 20 minutes every day, and progressively building it up from there. And that's what's going to set us up for success, progressively challenging the body. For muscle strengthening, you might say that where you're actually lifting weights such as dumbbells or resistance tubes or objects from around the house. I used to teach an online Pilates class where I used a tomato soup can for my weights the entire time, and it was perfect. Bottles of water around the house, jugs of water. I was also doing home renovation, so I was even using like a bucket of what goes on the wall for texturing. So you can get really creative with what's around your house when you're talking about doing these strength training, these muscle strengthening exercises. And so frequency, you're thinking about 2 or more days a week to actually focus on the muscles, strengthening the muscles. You also want to make sure that there's a recovery day between. So we don't want to be focusing on strengthening our muscles Monday and Tuesday back to back, but instead, maybe we'll strengthen our muscles Monday and Wednesday. The amount of repetitions or number of times that you're going to lift the weights, depending on our background, we might start with about 10 repetitions, which puts us into the muscular endurance category, which is muscular endurance is helpful for activities of daily living, such as being able to carry in our groceries over time. So muscular endurance is pretty important. And muscular endurance would be described as lower weight, but higher repetitions. And higher repetitions here being the 10 to 15 repetitions versus a higher weight at lower repetitions, considering lower repetitions could be, for example, 1 to 3 repetitions, 1 to 5. So here, when we're talking about muscle strengthening, I'm really recommending focusing on muscular endurance, focusing on a little bit lighter weights that are still heavy enough to challenge us at 10 to 15 repetitions, but weights that we still feel we can rock that 10 to 15 repetitions. I'd recommend, if you haven't already had strength training incorporated in your day-to-day, in your exercise program, to really start with maybe 1 to 2 days a week and just doing 10 repetitions one time for each of the muscles that you're looking to target. Then asking yourself the next day, how do I feel? If I'm noticing the next day that I am really sore from the area that I worked out, it's a sign that I worked too hard. If I notice the next day that I didn't notice anything, it might be a sign that I can challenge myself a little bit more, that I can go up in weights or maybe add more repetitions add more sets. This is when we can start to play around with the programming there a little bit more. So the goal the next day is you kind of want to wake up and feel like you worked a little, but you can still do all your activities throughout your day. We shouldn't have the feeling of being too stiff from our workout the next day. It should be kind of just that happy feeling of, yeah, I worked out, I can kind of feel it, but I can still carry on. So examples here of what muscle strengthening would be such as if I was holding my soup cans, bicep curls here. Again, you can use resistance tubes, whatever you have. You might not even need to go anywhere to get any other pieces of equipment. You might have everything at home that you could need to get in a great workout, to keep your bones strong, build the muscles that help to protect us from falls. And really consider balance specific exercises. We are going to dive into examples of a few exercises in particular that are really helpful for building the core, building the muscles of the lower body, muscles that can help us to stay upright, muscles that are great for fall prevention. And 3 exercises that I have as an example for you are sit to stand. And so this is my shout out to someone who had mentioned talking about doing squats with a walker. This would be a great example of that, where sit to stand, and you can, if you feel you are in a safe place, if you are comfortable where you are, if you have something in front of you, something to hold on to, or maybe not, you can try this with me. So I'm sitting in a regular chair. I have this table where the computer is resting on in front of me that I might use for support. Depending on my strength, and you know yourself the best, you know your level of ability, I might hold on super tightly. I might hold to this table, or I might hold on with just a few fingers or kind of lightly. Or maybe depending on how I'm feeling, I might not hold on to the table at all. You know your ability. And what's really great is this exercise, which is muscle strengthening. It's a muscle strengthening form of physical activity, can be great for all of us. So my feet, to demo this, and at some point my head's going to get cut off as I stand up. So bear with me. I am going to be starting in my chair. And again, I invite you to do this with me. If you're in a safe area, you have something to hold on to. Your feet are hip to shoulder width distance apart. My knees, if I were to look down at my knees are roughly in line with my second and third toes. Now I'm wearing shoes, so I can't really see my toes. But the big take home point is we don't want our knees to be caving in or buckling in towards each other. And we don't want our knees to be bowing out away from each other. So we want our knees in line with our toes, in particular, aiming for our second and third toes. And we want to be specific there because we want to be working the right muscles that help to support us for this movement. We don't want to be causing any strain on the joints. So for example, if my knees are buckling inward, I might be causing excessive strain on my knees. It might be a little bit uncomfortable. So I'm keeping my knees and toes in line. My knees are in line with my second and third toes, as I mentioned. And then even sitting right here, I'm going to start engaging my abdominals. Not enough to restrict my breathing, enough to maintain steady breathing, but enough to already find strength in my posture here. Now, I'm going to start to drive down through my heels as if I'm pressing my heels down into the floor. So digging holes into the floor with my heels. And just by doing that, I'm starting to fire up the muscles in my glutes. These muscles in the glutes are really great for, if we can build them up, they're really great for fall prevention. They're really great to help protect the lower back in the long run. So really important muscles to be working on strengthening. So I'm digging down through my heels. I might be noticing that my glutes are engaged, even though I haven't even gone anywhere. My abdominals are engaged. I'm holding onto the ledge, or I'm not, depending on how I'm feeling today. Keeping that same knee and toe alignment, I'm going to continue to press my heels down to lift myself up, coming into standing at the top. Now, when I stand up, I still have a soft bend in my knees. I'm not going to lock out or hyperextend my knees, which again might cause excessive strain on my knees. So once I've made it to the top, that is half of the exercise, because just as important as it is to stand, it's also important to take our time to come into a chair, because this can also be an important thing to practice, because in reality, sitting down into a chair can also be something that we need to be mindful of in terms of fall prevention. So being aware of where the chair is in relation to our body, making sure that we have a good position in front of the chair when we are sitting back. And that we are going through that same process that we did before. We're engaging our abdominals. We are watching our knee and toe alignment as we sit back. And we're slowly and in control finding our way to the chair, using as much support or as little support as we need. The goal with these forms of physical activity is to, yes, to challenge ourselves, but find that perfect balance of challenge and where we're at that day. So again, my example, I'm not a runner. I'm not a runner. Once upon a time, I used to run, but I'm not a runner. So for someone who hasn't really run in a long time, it wouldn't be realistic for me to do a marathon, right? So if I have been used to walking with a walker, and then all of a sudden I'm practicing, if I'm used to walking with a walker, what might be helpful for me is to really use that walker as a prop for my sit to stands, right? We want to set ourselves up for success. It is a form of strength to be able to recognize where we're at and moving forward with that. And we can use that walker as a great tool to help us strengthen the muscles that we need to strengthen, that can help us to prevent falls in the long run. So it's a huge sign of wisdom if we're able to use our resources in that way. All right, exercise number 2, which is just as exciting as exercise number 1, which is a single leg stand. This one might sound exactly like what it is, and is very similar to the sit to stand, where making sure that you have something to hold on to as needed. So if I'm standing up, I might just lift one leg and balance there. So I'm actually working on my balance. I'm working on engaging the muscles that help me to balance. And what I like to challenge people here is, when we're talking about balance in general, when we're talking about fall prevention, we oftentimes falls happen when we are in motion. So a single leg stand, which is just standing up and lifting one leg and hanging there, is really great to practice balance. But we might also even practice the transition of, all right, I'm holding on to something. I want to transition lifting my leg and lowering my leg slowly and in control. So doing a balance exercise in motion can be a great way to kind of build our balance over time. With that in mind also, a lot of forms of physical activity are in one plane of motion. And what I mean by that is, if I am walking forward, if I am hiking forward, if I'm riding a bicycle going forward, even if I am doing some strength training, such as my sit to stand. So sit to stand, all of those movements are pretty much going in one direction. However, in day-to-day life, we work in multiple directions. Such as, if I am in the grocery store, or if I'm in my kitchen and I'm cooking, I might be taking a few side steps to reach for something that's on a cabinet to one side. So I need to be able to practice moving side to side in addition to moving forward and back. And I need to be able to practice turning and turning safely. So all of these things, regardless of our background, as we continue to age, it's good to be proactive, and it's good to, wherever we are at in our forms of physical activity, in our ability to be trying to incorporate these sorts of movements. So a side step is a really great example of working in a different plane of motion, such as side to side. And it is exactly what it sounds like, where you're standing up. You could have a walker, you could have a table. I'm going to try to squat down here, and you are just stepping side to side, stepping side to side. So again, you could use support with that, such as a walker, such as a table. Without it, depending on the ability, you can even use resistance tubes. So, or a band, and tie the band around, making sure it's not pressing on the joints, but maybe right above the knees, so it's not pressing on the knees. And then you're working those muscles at the outer thighs, the hips. Again, when we're talking about the glutes and the muscles around the hips, really great to focus on building up those muscles in order to help us with our balance, help us with fall prevention. So sit to stand, single leg stand, single leg balance, and then side steps are three great examples of muscle strengthening exercises and balance exercises that can help us for fall prevention when we're thinking about bone health in the long run. Some things that we want to be mindful of. We want to avoid, if we have osteoporosis, we want to avoid exercises where the spine is in flexion. And what that means is the spine, intentionally rounding the spine forward or to the side, are what would be considered as more contraindicated movements that wouldn't be recommended typically by a physician. Avoid high impact exercise. This is where I return to my example of the marathon again. If I haven't been running, I wouldn't be setting myself up for success if I ran a marathon. I would likely injure myself. I have also taught college courses. One of the courses that I used to teach was yoga as an academic class. I currently teach Pilates as an academic class at a university. And some of the trends that I've noticed in terms of physical activity for some of the younger age groups is high intensity physical activity has been the thing, where the goal is to go into a fitness center or a gym or work out at home and kind of condense everything into like 15 minutes, where it's really intense form of physical activity. And there might be a lot of jumping happening. There might be a lot of jumping happening. What can happen is when that happens and we don't take the time to really strengthen and build the muscles up over time, to really prepare the bones for that form of physical activity, such as doing more of the lower impact physical activities, such as walking or climbing, hiking. If we don't prepare the body, it could lead to injury in the long run. So high impact exercises, such as any form of jumping where 2 feet are off the ground, I would say really be mindful of, because if we haven't taken the time beforehand to prepare the body, and sometimes this takes weeks or even months, it could lead to injury. It could lead to fractures over time. really interesting. Even elite athletes, such as those who prepare for the Olympics, they have throughout a year or throughout a few months or a few weeks, something called periodization, where they are preparing their body to perform at their peak on their game day. And so if they're to prepare their body for that, they have these whole periods of time where they are working out. They're spending a big bulk of that time working on that lower impact form of physical activity, so that their body is prepared for the higher intensity forms of physical activity, that high impact form of physical activity. So there's a lot of benefits from high impact forms of physical activity. However, if the body is not prepared for it, there's a huge risk of injury. And something that was extremely common in some of the students that I had worked with. So just something to keep in mind. And as with anything for physical activity, if you are feeling pain, always stop. The phrase "no pain, no gain," throw it out the door. Because you can get a lot of gains without feeling any pain. And if we are doing a form of physical activity and we are feeling pain, it might be a sign that we might need to tweak something. It could be our form, it could be the intensity that we're working at. Pain is typically a sign that we've gone too far. And then consult with your physician prior to starting any physical activity program. They might have specific recommendations for you in particular. And returning back to our whole idea of progressively challenge yourself. So maybe one week you're going to set a goal, like a very small goal. If I have been walking for 5 minutes every day, maybe I'm going to add a few extra minutes onto that, progressively challenging ourselves. Not going from 0 to 100, but maybe if we're already at a 1, going to a 2. And we might notice that over time, when we make those small changes, it'll set us up for success more, because it'll feel more achievable. If I go from working out 5 minutes every day to 10 minutes every day, or if I go from working out 20 minutes every day to 30 minutes every day, that sounds a whole lot more doable than saying, Olivia, you have not been working out at all, and now let's go work out 60 minutes a day. Let it be something that is sustainable for you, something that you can fit into your schedule, because where we get the most progress is not from engaging in physical activities such as this once, but it's engaging in physical activities such as this over time. So avoid anything such as sudden excessive strain on bones. And the excessive strain here would also be that high impact form of physical activity where there is a big momentum from gravity, where both feet are landing on the floor. And then if you're leaving today thinking that you want to increase your levels of physical activity more, you want to do some more muscle strengthening work, but in terms of form, it's really important maybe consulting with a physical therapist or some sort of exercise specialist, someone who is really well versed in osteoporosis, that can help you individually, who's familiar with who has worked with people who have been in your shoes in the past. So you can ask the question for the exercise specialist if they have worked with people with osteoporosis in the past, really making sure that the people that you're working with are educated in what you are going through, because that's really the most important thing. This would be the time that I would go ahead and open it up for questions. And I apologize with the comments as they were coming in, because I know I was able to tackle some of them, but I know I missed a lot. So this would be a good time for us to kind of go back now.
Wonderful. Thank you, Olivia. If you would like to unmute yourself and be respectful of others, we have a lot of people on the call. If you have a question to ask, please do so. I see one is up there. Feel free.